Answer.
Yeah, Mr. Chairman, I was very concerned with Dr. Husk's testimony because the data that we are accruing in Uganda, and especially from my institution, which is closely involved with the HIV AIDS since the early 1990s, clearly show that treatment is associated with strong incentives for prevention. So my submission today is that data which we have shows that that is what we have right from our clinic and the data that we have recently published. We followed up 3,400 severely infected patients with AIDS, and we found among those 340 babies were born. Not a single one among those was infected with HIV. And secondly, not any of the babies have been infected through breastfeeding. On maternal and child health, if we can provide PMTCT, we can prevent lots of pediatric infections. On the adults, we are finding that discordant couples who are high-risk groups, perhaps the highest risk groups, if you treat the infected partner, we are getting as high as 90% reduction in infection. And then, very, very impressively, we find that if in any clinic you introduce treatment, people coming for testing just increase almost overnight. We have found very opposite results in clinics which do not have treatment. People just don't go for testing. Our studies are indicating that it is people who don't know their serostatus, who have no incentives to come for testing, who are contributing significantly to the continuing spread of HIV in our countries. I'm not saying that prevention is not important. I'm saying prevention and treatment, both of them are extremely important, and they need to be scaled up together. I would state quite categorically that without treatment, prevention is futile.
Thank you. Dr. Carter, maybe you can respond to one of the questions, and Mr. Palimaveda is on his way down, and then we'll hear each of you answer one of them and see if there are any remaining questions to be answered. Thank you.
Yeah, thanks a lot. One question you asked was about the GHI's intent to work more with multilateral institutions, and maybe I'll just say a few quick comments around the Global Fund. I mean, just to say that given that the Global Fund is providing about 2/3 of the external donor funding for tuberculosis and malaria, it's actually a key and about a quarter of AIDS funding. It's a key backbone for U.S. efforts. And if you talk to the President's Malaria Initiative folks, but also as far as TB, and certainly a really important partner on HIV/AIDS. And again, I think really complementing each other in the sense that PEPFAR has certainly been more focused, but the Global Fund, again, working in 144 countries, has got that breadth of efforts that's kind of complementing, but also filling in many of the gaps that PEPFAR is not reaching. I think, as you're aware, PEPFAR is also providing important technical support, technical assistance to help in the implementation of Global Fund grants, and that's actually an important role. And I would say there's a few lessons that are being gleaned from the fund with regards to value for money, like how do we reduce commodity costs? How do we actually benchmark the cost of quality interventions? Like, what does it cost to deliver AIDS treatment? What does it cost to deliver prevention in certain areas? And benchmarking some of those in a way that I think can benefit not just the Global Fund, but kind of all of our initiatives, and helping us find efficiencies on that. So those are just, I think, some of the ways that PEPFAR can partner with, but also, I mean, in a very substantive way, but also in a kind of aid effectiveness model with the Global Fund is quite important.
Yes.
Mr. Chairman, you asked how I could help bring attention to my peers in the Hollywood community or other public people so that they can help support this effort. I will commit to engage my peers in Hollywood. What I'd like to say is that I think what's an even more powerful strategy is to involve young people in the political process, to build leaders among our youth. I'm so glad to see so many young people here today. I came a little bit late to the process. And I'd also like to say that it's, I believe that it's part of our DNA as Americans to help, regardless of where it is. That's been proven with our reaction to the Haiti crisis, and I think it is our moral imperative. So I think that you can get people from, I'm sorry. I think that people in my community like to stand behind things that they know work. And the efforts that the US government has made, the investments that they've made in HIV prevention has been proven to work. And it's been great, good works so far. We just need to increase the funding for prevention so that the good works can help more people.